Hi, I'm Amanda, one of the physician assistants at Care Pediatrics. Typically you'll find me at our Charleston location, but sometimes I go to other locations as well. I wanted to talk about one of the most common complaints I'm getting this year from parents, and that's going to be nosebleeds. I know it can be really scary to see some blood coming out of your kid's face, but if it's just a regular nosebleed, there's typically not a cause for worry. What you're going to do is first thing, stay calm. Let your kid know that it's okay. Just reassure them with a nice, easy, steady voice. Step 2 is going to be have them sit up, lean forward, and then that's going to help us prevent the blood from going down to the back of the throat. A lot of times you're like, no, stop the bleeding, and you pull it back like that. I want them leaning forward so the blood comes out of the face rather than getting swallowed into the tummy. That can cause some irritation. Then you're just going to take a tissue. You're going to pinch the soft spot of that nose. I don't want the bridge of the nose, the hard part. I want the soft, squishy part. That's going to help stop that bleeding with that pressure. You're going to hold that pressure just gently for about 10 minutes or so. If your child's old enough, you can have them reach up and keep that pressure there while you go clean up whatever just happened. But really I want that pressure to be on there for about 10 minutes or so. Don't peek, because if you let go of that pressure, sometimes that can be the cause for it to continue bleeding when it would have stopped. If you're bleeding through more than one tissue, you're just going to take another one, put it on top. Don't replace it, because now we've moved that blood clot. And avoid stuffing tissues inside the nose. I know you'll see like on the shows and stuff, they roll them up real tight and like shove them up the nose, or like a little tampon. Avoid that. Ideally just that pressure is what we're going for. If for some reason your kiddo's nose doesn't stop bleeding after about 20 minutes or so, or it's happening pretty frequently, go ahead and give us a call, bring them into the clinic. We can talk about some other reasons why that might be happening. If your child is prone to nosebleeds, they might benefit from a humidifier in their room at night just to moisturize that air to counteract the dry desert heat. And sometimes they can even benefit from a little bit of saline nose spray or some Vaseline on the inside of that nose. But if you're concerned, go ahead and come back on into the clinic and we'll make sure that that treatment is appropriate for your child. We're always here to help, so feel free to give us a call, make an appointment, and we'll be able to see you at any of our 4 locations.